As Brazil began to experience the first cases of Zika, insecticides used to kill mosquitoes carrying the virus were difficult, if not impossible, to come by. In Campina Grande, the epicenter of the Zika outbreak, mosquito control efforts for 400,000 people suffered a setback.
The worst was October through November. We did not receive anything, so it was not possible to do a complete coverage.
Brazil's health minister, who took office in October, denies the shortage was serious.
If there was this shortage, which I cannot attest to whether there was or not, it was for a short time and an isolated incident that did not affect the overall situation.
It wasn't an isolated case. Prosecutors investigating the shortages have uncovered evidence larvicide shipments were rationed to all of Brazil between August and October. States at the center of the epidemic ran out altogether. One top disease control official suggested municipalities use bleach to kill mosquito larvae or small fish to eat them.
Our municipality was a pioneer in the distribution of fish to fight the mosquito. It made our situation a little bit better. Without the larvicide, our agents could not do the work.
By the end of 2015, doctors began seeing a spike in deaths linked to viruses transmitted by mosquitoes. Cases of microcephaly, a rare birth defect that could be linked to the Zika outbreak, were also on the rise.
In December, we started taking care of the first babies, and the difference between the number of cases from a year earlier is alarming. I went from treating 2 or 3 babies per year to 17.
Hit hard by the deepest recession in decades, states cut spending last year on mosquito control efforts despite a plea from the World Health Organization to strengthen mosquito control. On top of these cuts, Brazil's infrastructure and tropical climate make managing the Zika outbreak difficult.
Because we don't have a good sanitation system here in Brazil, we don't have the climate is also, the temperature helps the virus to replicate faster in the mosquitoes.
While Brazilian scientists have won international praise for quickly identifying a possible link between Zika and microcephaly, authorities so far have been unable to leverage those discoveries into public health victories. Luke Sheridan, The Associated Press.